So good morning. It is great to see you all. I'm impressed on 8:30 on the third day of this conference to see that many of you here. Maybe you guys are like the scale warriors that just kind of won't let go and can't get enough. But it's great to be here. And I'm particularly appreciative to be at this conference on scale because I think this is a moment where we really are at an inflection point. A lot of extraordinary work has been done over the past decade by many of the people in this room to take us to a place we couldn't have imagined 10 years ago in terms of knowing what works, scaling to a certain extent what works. And a lot of people I've been talking to over the last 2 or 3 months are raising a similar set of questions about where do we go from here? Because the path that got us to this point, many people think isn't going to be the same path that really enables us to achieve the full potential of what's been built by many of you. And let me give you an example. I've spent some time talking to Gerald Chertavian, who is the CEO and founder of Europe. And Gerald has been posing a set of questions, and over the last year or two has been very focused on kind of what it is that Europe does next. Now, Europe is a program that works with 18 to 26-year-olds, kind of with a whole suite of supports to help strengthen their ability to attain a higher level of education and find better outcomes in the job market. It's a one-year program, classroom skills, college credit, and internships with corporations. And it's something that has produced results kind of in the form of educational attainment for these young adults, as well as better employment outcomes. It's grown over since 2000 to now be in 10 cities and serve 1,900 young people. So in many ways, one of the stories that many of us tell in speeches of extraordinary impact. But when I talk to Gerald, he's posing the question of, it's great that we're at 1,900 young people, but there's 6.7 million young people that could benefit from this service. And it's that disjuncture between where we are today and what the need is that's causing him to think about, is the path forward the same path I've been on? So they're literally thinking about their strategy, saying they could have a 3-year plan that says, let's double the size of Europe. Let's get it to 3,800 young adults. There's still 6.7 million in need. So they're beginning to experiment with some different pathways, one of which, for example, is partnering with community colleges and helping them actually scale the Europe practices and principles through community colleges, and enabling them to do that through consulting, training, and technical assistance. A second pathway they're looking at and very deeply exploring is whether they ought to build a really large sales force that goes to businesses and persuades businesses in the power and the value of this set of capabilities in the form of these young adults, and essentially create huge demand that pulls through Europe, other organizations like Europe, and in fact has an economic model that you can model out, and it could actually be a self-sustaining model because these businesses would actually pay for these capabilities. Another thing they're doing is they're actually working with the Ad Council, saying, what if we kind of try to shift public will and public understanding of the capabilities of these young adults, and more broadly, influence the broader policy sets, practitioners, and so forth. And he's literally at this point saying, which of these paths make sense? And what's striking to me is that I've been talking to a lot of people lately that are in a very similar place. And the organizations on this list, many in this room over the last 10 years have similar stories to Europe of impressive growth that we would have never imagined over the 10 years ago that they would have reached this stage. 1.2 million people at communities and schools, youth villages, Teach for America, Nurse Family Partnership, the Center for Employment Opportunities, Bell Foundation, KIP, Europe. Really impressive stories. And it is a non-trivial accomplishment that these organizations now, and we now have evidence of the kind of impact they have and the kind of potential they have to actually address some of the most important challenges. But when you, again, step back and think about how they rank against and stack up against the kinds of problems they're working against, it's very much the Year Up story again. Very small percentages of folks that could benefit from these programs are actually being served by them. This is not to say these are the only people working on these issues. There are other players, there's other providers, there's fields, and we'll talk some about this. But even if you added all that up, I think we'd all agree that the gap between where we are today and where we need to be is enormously large, leavened by the fact that actually we now know in several of these cases what it might take to actually change the outcomes on the right in those kinds of outcomes. And so what I want to talk about are what are the pathways that are starting to emerge that actually connect these 2 points, that connect where we are today with the possibility of truly moving the needle on the needs that we're seeing kind of against these different problems. Now, these glimmers come from some experiments folks in this room are doing. They come from global examples. They come from the for-profit world. Some of them are, frankly, back to the future, because some of them are, didn't we used to do this? What would it mean to do it now, but do it in a slightly different way and more powerfully? And so this is really to highlight several pathways. The first one of which I want to start with are a set of pathways related to organizations and what they can do to scale their impact. And I use this little equation, 100x, 2x, to exemplify it, meaning can we get 100 times the impact with 2 times the size of the organization? So what we're looking for is not just linear replication and growth, but are there ways to actually scale impact far beyond the organizational platform that exists there, so that we're scaling impact beyond scaling organization? And that's the problem that Gerald's struggling with, and a whole set of organizations are really puzzling about. So I want to highlight several pathways that are starting to emerge as people are doing that. Pathways relates to field strategies, and basically what that is that starts on the right-hand side and works back to the left. And here I use the phrase all is all, because the question here is if we actually, knowing that we have some things that might have promise and might work, what if we started with the end and said, what would it take to actually create a field, scale solutions, so it actually had the kind of population level effects that we all aspire to? It's very much the question that Jim Furman asked Jim Canales yesterday in the Q&A after Jim's talk about, could we look at this in this broader canvas? And I want to highlight a few pathways there of how these things relate as we do this work, and kind of pathways that enable us to work backwards. Now, all of this is embedded in an ecosystem and what I call the What Works movement. Because, and I'll talk just briefly about this, but it's hugely important because we can do a tremendous amount of work on these pathways. But unless the broader ecosystem rewards results, it is going to continue to be pushing a boulder up a hill, which if you talk to the various social entrepreneurs and nonprofits and funders that are doing this work are saying man, this is hard, and it doesn't get easier. It kind of, as you get bigger, it gets harder. And so this broader context is hugely important. I want to just talk about a couple of the things that are happening there. So let me jump into the organizational pathways. And the first one is distributing through existing platforms. Now, the basic idea here is that we have in this country and around the world large networks that create the possibility that you could actually identify solutions and spread those solutions through those networks. And one of the most interesting ones is the YMCA. Now, the YMCA is a 160-year-old organization. 60% of Americans live within 3 miles of the YMCA. It's spread across the entire country. Imagine if we could actually scale things through that as a distribution system. And in fact, that is what it's beginning to do. With a program called the Diabetes Prevention Program that was developed at NIH and with the CDC, it's a lifestyle intervention that is focused on changing behaviors related to eating and exercise. They have found they can reduce the incidence of type 2 diabetes by 60%. 60%. And the YMCA took this up in Indianapolis in 2004 and began testing it. And kind of figured out how they could implement it in their system. And in the last 3 years, it's now grown to 386 locations with a plan to scale much more dramatically. Now, I think this pathway is one of the most important and exciting and untapped that's out there. If you just take diabetes, 25 million people suffer from diabetes, 75 million are at risk. And anybody who studies the federal deficit problems sees that the issue of chronic disease in terms of healthcare costs is a gigantic force for that. So the potential of the Y in this program to actually move the needle at scale on a big problem really is extraordinary. Now, if it was easy to do, obviously, we'd have 100 stories of this working. It's actually a hard thing to do. The Y has to make significant investments in this platform to change how it works with affiliates, technology infrastructure. There's a set of things required to build that platform. But it is a potentially hugely powerful leverage point. You also, the folks that have the interventions, imagine we wanted to scale after-school programs through the Y. The social entrepreneurs, those that have the interventions, would have to change how they think about control of their program as it scales through the Y. So there's a lot of things that need to change to make this, to achieve the full potential, but a huge opportunity. Second pathway of organizational scale is what I call unbundle and spin out. And here the simple question is, if you look at any of these programs, they're a constellation of elements. And the question is there a component that accounts for a large percentage of the impact that could be easy to scale? And the example here that I just want to highlight is KIPP. We all know KIPP, over 100 schools, lots of evidence of high performance, a complex model of many, 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 many pieces. Now, when you think about what's in those pieces, you can think about the culture they create, the curriculum, the way they recruit teachers, all of these pieces. But one of the things that has stood out as being particularly powerful is how they train principals. And in fact, KIPP received an I3 grant to take its principal training program, which it uses internally, and actually create an institute that made it available to 31 other organizations and districts, including many of the largest school districts in the country. And so now an element of the KIPP model is being scaled that way. Now, I'm not arguing that that program has the same outcomes as a KIPP school, but if you think about the scalability of this element of the program, if indeed it does have results and can have impact, it's done at a much lower cost, much greater scale. The net result, the calculus of that equation of the cost impact value here may be very high. And I think there's a lot of programs where the thinking needs to be had about what it will take to actually do that. Let me go to the third pathway, enabling others. This basically is the simple proposition that a lot of these programs have become expert at doing fairly complex things in many cases, and therefore their growth is limited by kind of replicating the entire program place after place themselves. And the question is, could they somehow create relationships with others, give them metaphorically, the template, the recipe, to go do it themselves? And could that accelerate scale if, in fact, you were able to do that, perhaps with the original organization providing technical assistance, providing training, consulting to them to make it possible? And in fact, the Gerald story is essentially this at Year Up. He starts with this model, and right now what they're experimenting with in Miami and a few other cities is working with very large community college systems to train them and help them be able to take the model and scale it within their institution. Now, these are a diverse set of organizations, and the question is that Gerald is facing, and as I've talked to other leaders about these kinds of, this particular pathway, they all are struggling with, well, what is the point of leverage and the kind of work that you need to really, over time, have this group of independent players behave and operate in a way that actually does generate the results that the original program has. Now, one of the points that comes out of this as I talk to people is they're all struck as they undertake this that, wow, this is a different set of capabilities, that doing something versus enabling something are really different businesses. And that one of the things they're struck by is that we tend to systematically underestimate what it takes to do the second one well. One of the things when I share this with people, they say, oh, interesting pathway, but TA never works. And I say, well, if you underfund it and you do it poorly, it tends not to work. If we actually experimented with the possibility of doing it well, I actually think there are a set of conditions where it will work. And we have some of those conditions in the intermediaries in this room that are testing that. But I do think we need to figure out kind of under what conditions it works, how, kind of what are the most powerful leveraged forms of influencing and enabling others to do work. The fourth pathway is leveraging technology. We've heard it through this conference about that. I just saw this morning in the New York Times, there's a big pull-out section on big data. It's hard to imagine any scenario, any pathway that doesn't involve a much deeper commitment to technology than we've seen to date. Last week I was at a meeting, actually with Mindy Tarlow and a few other nonprofit leaders, with some hedge fund philanthropists here in New York. And we were talking about the differences between their investing in for-profits, investing in nonprofits, and it was kind of a discussion in part about where are some of the differences. And after the meeting, a guy pulled me aside and said, well, the biggest difference is that in the for-profit sector, technology's changed everything at the organizational level, at the industry level. And in the nonprofit sector, I have a hard time finding anything remotely like that in terms of the potential impact. And is it just a lag effect? What's going on? And I'm hoping it's a lag effect, but one of the systematic barriers there, which this person put their finger on, is we spend less on this. This was a study that Bridgespan just released, it's on our website, called Stop Starving Scale, because the way we use overhead and allocate overhead and invest it is very different than what is needed to actually drive results in the sector. The for-profit sector, as a part of its overhead and part of its budget, spends roughly twice the amount of comparable with control for size, control for service businesses, and so forth, as nonprofits on technology. A really important gap that if we think about how you scale all the way to the right is going to be something that we need to close. Now, there are some folks doing interesting work in this. So like Kaboom is an organization that helps organize communities to build safe, healthy play spaces for kids, playgrounds. In the first several years it did its work, it basically sent a person into a community. They spent time building relationships, building partnerships, then they'd build the playground, and there's a whole set of kind of follow-up kind of support activities that go on. With the help of Omidyar Network, which Pierre Omidyar is the founder of eBay, they made a very substantial investment in a set of web tools that enable communities to actually download the tools, download supports, communities of practice and discussion about doing this work that enabled them on an annual basis to serve 10 times more playgrounds and create 10 times more of kind of what their outcome was that they were seeking through their work, through this technology. And there's a lot of stories like this. Really important to recognize the potential power of technology here. The one thing I would note when I talked to Daryl Hammond, who's the CEO and founder of Kaboom, he said, this is all true, which I was encouraged to hear. But he said, one of the interesting things that's happened is that the difference on an annualized basis from the hands-on building versus the technology-enabled. But a big part of the technology-enabled is actually middle-class communities using these tools to build playgrounds, which is not a bad thing. But he said, we're grappling with what it means for our model, because we're about focusing on disadvantaged communities, communities that don't have access to play, which still, the technology dramatically increased it, but it's a little bit of on these pathways, we're still learning. Like, how do you actually play out these pathways as you go forward? Now, the final pathway on the organizational side is what I call mega scale. Now, this whole talk is predicated on the fact that an extraordinary set of organizations and solutions have gotten to a certain point, but it doesn't seem like they can get further without cleverly coming up with different pathways. And while I buy that, that's a really important thing, it's also true that these things that work we ought to keep investing in. They ought to keep growing. Now, they by themselves aren't going to close the gap, but if you take youth villages, for example, kind of led by Pat Lawler on the right here, on the upper right, they're an organization that 15 years ago adopted multisystemic therapy as the way they intervened and worked with kids, which led to more kids being served in residential settings in their homes with a whole suite of supports rather than in residential settings, in homes of various sorts. Last 15 years, it has shown extraordinary results, twice the outcomes of comparable organizations at 1/3 the cost. Now, when you show this slide, which I do occasionally, to a for-profit audience in the context of scale, they're just puzzled. They literally go like, why don't we invest in that? And you're going, well, we are some. There have been some real, in the last 10 years, Youth Villages has grown substantially to 12 locations, thousands of kids. The Ed McConnell Clark Foundation and a whole bunch of co-investors in this room have been critical to that growth. But there's no natural limit why it has to stop now. And I just think there's a basic question about why is it that we tend to say, oh, we've kind of had enough of this thing that's twice as good and 1/3 the cost, that pays for itself, and we move on or we come up with other pathways. So I just couldn't do this presentation without making this obvious point that it's a reminder to all of us that these folks that are working and driving results ought to be encouraged, supported, and it ought to be made easier to access capital, access talent, so they can continue to do that. Now, let me just step back in a few high-level observations about these organizational pathways. The first one is around impact, because at the end of the day, if there's not impact in these pathways, why do them? And I think one of the real shifts in the last decade, led by various folks in this room, has been this focus on evidence, this focus on data, focus on results. And this isn't about, now let's jump to some clever ways we can kind of get these things out into the world and leave behind the discipline we've had about thinking about impact. When we think about the KIPP Principles program, the impact is going to be different than a KIPP school, but we ought to be very disciplined about what is the impact we're trying to achieve, are we achieving it, what does it mean to implement it in a way that we capture those results. You see this in the YMCA, same question about impact. The Daryl Hammond story is true for all these pathways. Do the pathways inadvertently shift the target beneficiary group in a way that's unintended? So really important that as we're innovating and thinking of these pathways, that the issue of impact is top of mind. The second part is capability, and I touched on this in the enabling, that all of these pathways take serious investments in capability. A technology-centric organization is a really different organization than a hands-on, build-it, everyday organization. What it takes to consult is very different than what it takes to build and do. Different capabilities. And I think one of the patterns we see is often asking these organizations that have done remarkable work, on the side, why don't you do a little consulting to help others? Let's have that be your replication strategy. Or do a case study, send it out, and people will copy it. It's just like, if we're serious about these kinds of pathways getting to the right-hand side and making a real difference, we have to think fundamentally differently about how we invest in those pathways to make them real and to actually achieve the results that we hope to see. The final observation on the organizational pathways is innovation. And here, it's about innovation in the scaling strategies, not a focus on innovation in program design. Because all of these are questions about how do we reach more people. Now, a couple of months ago, I met a guy named Desh Deshpande at an event. And Desh is a very successful entrepreneur, taken 3 companies public, each with over $1 billion market capitalization. Just an extraordinary businessman and also a leading philanthropist in India. So I bump into him in this event, and he goes, Jeff, I've read your articles on scale. I'd love to talk to you. And I'm kind of like, ooh, that's good. So want to talk to him, and I'm kind of proud of this. And so the next month, I go up to his office up on the North Shore of Boston. And we sit down, and he said, I read your stuff. Really, really terrific. But if you're serious about scale, you need to study India. Like, why are you studying these things that are like, do you think we could add 1 city per year for the next 10 years? He said, it's not bad, but he said, if you're serious about scale, he said, I fund a program called Akshapatra in India that serves 1.3 million children a midday meal a day. We fund a science program that reaches 5 million people. Completely different scale. And his point was, if you think about the end, what we're trying to achieve, and think about what are solutions to get to that, you actually end up with some different solutions. If you start with that end in mind, cost becomes a crucial consideration for this scalability question. And so I think that that sensibility is an important one, because let me go back to the YMCA for a minute. When the NIH and the CDC looked at diabetes prevention programs, what they found was a program that was a one-on-one program in a clinical setting that worked. They then spent a few years testing whether or not there were different ways to deliver that, ultimately evolving to a model that was a group model delivered by trained lay people, which actually could be scaled through a national network like the YMCA. So this final point on cost and innovation is one I just want to underscore, because again, if we're serious about how do we get to the right, how do we meet the need, we need to take really seriously cost considerations and innovations in how we scale these things. Now let me shift to the market-based pathways and highlight a few of those. And here again, the concept is, what would it take to start on the right and think about what would have to happen in the field to meet the need and to really move the needle at a population level? The first one I want to highlight is systems change. And here I'm going to refer to last year's keynote speaker here, Patrick McCarthy, who I think did a terrific job outlining how to think about systems change. And why does this matter? Because for a lot of the problems we're working on, for example, in child welfare, like the kids are in a system. So we can talk abstractly about change and scaling results, but if you want to scale results, you're talking about how do you scale results within these systems or in the education system. And Patrick talked very, very powerfully about the work of the Casey Foundation, kind of what they've learned about kind of finding the critical gears, kind of leverage points in the gears of government, kind of the kind of capacity building that can help change systems in government. I mean, a set of ideas there that he played out and highlighted in the Juvenile Detention Alternatives Initiative, which is an initiative that focuses kind of at the front end of the juvenile detention process and helps caseworkers think differently about whether you put a kid in detention or you have them go down other pathways. And there's a lot of data and evidence that the other pathways are much better for the kids. And over a 20-year period, one of Patrick's messages was this takes a really long time, these system change efforts. The 100 jurisdictions they're working in have reduced the census of young people in juvenile detention by 35% on average, which also has a whole set of cost savings, and there's a whole set of benefits there. So I think that I just urge you, go to YouTube, see Patrick's video if you want to go get the deep master lesson on system change. Now, Patrick said something last year that really stuck with me, and he said, a poor system will trump a strong program every time. A poor system will trump a strong program every time. And I think it was a lesson that kind of hit home for me and my colleagues at Bridgespan. I think about different work that we're doing. If you're thinking about the right-hand side on problems where a big system is a big part of the puzzle and you're working on a program thing off kind of in the stratosphere, you're not going to get to the right-hand side and solve that problem. That said, I actually think programs, though, can play a critical role in this change process. So, for example, if we take school reform, you have inside the system innovations, changing teacher training, changing time, changing a whole set of things that are important, tested, things that are working and helping move kind of change management processes within the system. You also have proof points, different organizations outside the system like KIP that influence and change the debate in the system. A very simple thing, but in Boston, the one KIP school in Lynn has had an influence on the conversation of the Boston public school system. Now, you can say that's crazy, but when they look at the results, they're like, how do they do that? And what does that mean for us? all kinds of complexities of how you translate that learning into the system, but it's a real impact related to system change about how this works. Now, a second one that is interesting is Teach for America, and I call this kind of an outside-inside strategy. Now, Wendy Kopp and her colleagues 25 years ago when they started Teach for America focused on the lever for education reform being bringing Teach for America teachers into schools. She said that, and she said, well, we think differently now about how we measure the outcomes and the results that we're seeking. And I said, well, tell me more. They're now, the way they think about it is they're in 46 geographies across the country, and their goal is to change outcomes for kind of disadvantaged kids in those 46 geographies. One of the tools of that change is the Teach for America teachers. Another really important tool are the TFA alumni, the 30,000 folks that have been through TFA. And I've heard about this for a long time, and I thought, like, I didn't think it was just kind of a warm and fuzzy thing about keeping your alumni engaged, but I didn't understand that TFA has a staff of 170 people that manage their alumni programs. Every one of these 46 districts has 2 to 3 people that are mobilizing the energy of alumni and other community folks to put pressure on the system, to help the system, to move the system across these 46 geographies. A program that's having a really significant influence kind of on the system, and also reflecting what kind of investments it might take to actually take seriously efforts to move the needle to the right. So now let me shift to the second pathway on kind of how we move from the right to the left, which is elevating fields. and there's a lot of examples of this in this room. Just to make it very concrete, because this is what the kind of thing we're working with. Last week in the New York Times, there was an article about Chicago that said private preschools see more public funds as classes grow, a shift in a patchwork system of early education. I mean, what is a field? I mean, I don't know if it's in its best case or its worst case, it's a patchwork system, but it's the constellation of players that are all aiming towards some outcome on the right that in this case are private providers, Head Start, nonprofit providers, accreditation agencies like the National Association for the Education of Young Children, different funding mechanisms, a whole cast of characters that together are trying to move the needle on early education. And the question is kind of how can we think about a field and how can we think about moving and elevating the performance of a field? And what I want to just share briefly here is just a framework, and I'm not going to go into it. This actually builds on work that the Irvine Foundation did, and Jim Canales in yesterday's keynote talked about the linked learning program at Irvine, and in the context of developing that strategy, developed a framework about how to think about fields, and it's actually on their website and Bridgespan's website called a Strong Field Framework. And it just creates a set of categories and a way to profile a field so that we can understand where there may be points of leverage, where there may be opportunities to strengthen a field. And again, as I sat in the conversations yesterday, both hearing about linked learning, which is about kind of linking education outcomes with career paths in California, when I talked about, kind of sat in the breakout group on education around extended learning and extended time with Jennifer Davis and with Jeannie Oakes. I mean, all of these were discussions about field building. What are the complex of players that you need to move to get things headed in the right direction? What I want to highlight are just 3 areas in this field context that I think are particular opportunities or are potential threats to any efforts to try to elevate a field. The first one is leadership pipelines. In education, one of the striking things is that between Teach for America, New Leaders for New Schools, recruiting new teachers, the Broad Superintendent Project, there's been this huge 20-year investment in talent. And if you talk to these folks, they all bemoan they don't have enough talent. But compared to the rest of the fields, in terms of disciplined, intentional building of pipelines of talent, it's really quite extraordinary. But when I look at community colleges, a whole set of other fields, this potential gap of are we building pipelines into the fields, are we supporting the development of folks in the fields, I think is a huge watch out. So as we as we develop models that work, if we don't have people that can implement them, drive them forward, lead them, we don't have anything. So this is just an area that I think is of particular importance. Second one is implementation science. And the issue here is a program with medium results, well implemented, will outperform a program that has kind of a proven program that's poorly implemented. The issue of implementation is this subtext to everything. We're finding things that work, and then we're getting stuck on the fact that, you know, it works kind of in city A in this very controlled setting, but as it goes out into the world, we actually don't know what is accounting for the fact that it doesn't work in a lot of these cases. In implementation science, there's a group of folks at University of North Carolina that are very focused on studying this deeply. MDRC is studying questions of this sort of kind of what accounts for the variance and outcomes of these different pieces of programs, how they work, why they work. But I think this issue, and you can Google implementation science and see a whole bunch of research on this, I think is a really important one, because I think the vast majority of the variance as we go from this phase to the next phase is accounted for by differences in implementation, not differences in program design. The third and final point here is shared measurement. And one of the most important shifts in the last decade has been this focus on data, metrics, at an individual level, but also at a collective level. You know, when you think about the Common Core, you think about the work in the education field, you think about the work in a city like Cincinnati that Strive has done in creating a common platform of measures and metrics. You think at the global level of the Millennium Development Goals that are now being reshaped. This issue of creating some set of shared expectations about metrics and the data that we need to have is a critical piece of elevating these fields. When I talk to Billy Shore, who's committed Share Our Strength to ending childhood poverty, when I talked to Patrick McCarthy about systems change here, talked to Michael Brown here yesterday about City Year, talked to any of these folks, they all say the key thing is data. Data and the metrics that we can align fields against so that we know whether we're on track. It also has the secondary effect of creating the opportunity to learn and to actually be iterating about and experimenting with over time kind of what we're doing on some of these implementation pieces. So this whole question of shared measurement, I think the work that FSG has done on collective impact is hugely important in this. I mean, it has really helped name an important phenomena that we need to better understand, and I think a lot of the future of elevating fields is going to depend on this piece of the puzzle. Let me share the final pathway, which is catalyzing markets. And here the simple observation is if you start on the right and work to the left, a lot of the problems we work on encompass both for-profits and nonprofits in various ways. So for example, if you take globally microfinance, microcredit, 30-ish years ago, Grameen, Bradach, a set of institutions, set of nonprofits, started making loans to the poor, developing expertise and depth of expertise in how to do that. Their models grew. And then there was a point in time when the for-profit sector, commercial banks and so forth, looked at this and said, actually, there is a base of the pyramid business here. It led to an inflow of capital and a significant growth in the number of poor people who have access to capital. Now, it's obviously a much more complicated story. And Anthony here, whose book, Impact Investing, is terrific on kind of articulating different pieces of the puzzle of this. And so this isn't saying, thank you, markets, they're going to save us. But the fact that we don't, in most problems, in most strategies, we don't even look at this broader context. And if you think in early childhood, in child welfare, in education, I mean, the big breakthroughs in education are as likely to come from individual software companies doing personalized learning platforms as they are from philanthropists investing in any number of reforms. And there's just a lot happening across this boundary, and we tend to stay very siloed and not look across these things. There's for-profit management companies like Acelero working to manage Head Start centers. We just need to open the aperture to think about what are the different pieces of the puzzle that are really going to drive results here, because it can bring new capital and sustainable revenue models if the conditions are right. Now, covers the individual pathways, these glimmers, and these market-based pathways where we kind of, these field-based pathways where we look at the end and work back. The final thought is just on this what works movement, because again, I just can't emphasize enough, we could spend the next 10 years cranking away on these pathways, and if government, for example, in contexts where government funding is driving the work that we do, is not rewarding those with results and is not moving money away from those that don't, it literally is closely for naught. It is such an important piece of the puzzle here. And the good news is, and we saw Linda Gibbs yesterday, we saw Sonal Shah, there's things happening at various points in government that begin to suggest there's some encouraging news on that front. In terms of pay for success, in terms of dedicated funding for building evidence and evaluation, for various kinds of grant processes that reward results and differentiate those that have strong evidence from those that don't. They're still glimmers, they're still small, but they're important. If you take just the pay for success work that started in New York with MDRC and Bloomberg, and the project on Rikers Island, you look at Massachusetts, the work with third sector, in Roca, you look just last week, the Pritzker Family Foundation announcing another social impact bond in Utah in collaboration with Goldman Sachs. We're starting to see glimmers of these things. And the watch out here for me, and the final thing is that there's a group called Results for America that's actually trying to build a broad-based coalition of people to focus on what works. And it's hugely important. One of the challenges in all of this is that people will look at, for example, the social impact bond in Massachusetts and say, well, we don't really support ROCA, so this isn't for us. Or, we don't really do advocacy on things like what works, it's not for us. If there's anything that's about us, it is getting more money to things that work. And I just think we just need to think hard about when we make decisions and investments if we're serious about shifting the paradigm to solving problems, that's got to be a big piece of the puzzle. So, in conclusion, the first point is it's not a horse race. A lot of people I talk to, and even listening to the subtext of some of the conversations in the last 2 days, are kind of, it's not about organizations, it's about fields. It's not about fields, it's about organizations. It's about impact investing and not this. It's hard to imagine any scenario that gets us to the right-hand side of solving problems that isn't about all of these things and isn't about these things, in some sense, being a little bit more choreographed with each other in what they do. And I just think we need to recognize you can't imagine a field without really strong practitioners driving the work, and it's hard to imagine just those practitioners alone getting to the far right-hand side. Second point is, with the big tree, little tree, is that we need more big bets. One of the things that's propelled the progress that we've had in the last decade are a set of philanthropists that have actually committed big on almost every one of the stories that I've told on the people here. And it's not because of the big bet that they've done great work, but it's been hugely important. And when we look ahead to the next decade, if we're serious about moving to the right, it's going to take a lot more money. Even if we reduce the unit cost dramatically, there's no way that you serve 80% more of the market and it's not going to cost more. And I think we just have to confront that is true. Now, the return on it, as the Youth Villages case shows, as these pay for success things, can be very high economically. But we simply need more people to bet big against these things if we hope to move to the right. And the final point is it's going to be hard work. That, Patrick McCarthy's notion that it took 20 years, or kind of comment, it took 20 years to get the Juvenile Detention Alternatives Initiative kind of moving. It's taken all the organizations I've talked about here, I've been using the comment decade. Most of them it's 15 years, 17 years, 20 years. Long time. I mean, it takes a serious amount of time to do this. And in this phase, I think the challenge we have is it's investing in things like overhead. It's investing in industry infrastructure, field infrastructure, things that we tend not to do. But if we're serious about getting to the right-hand side, we have to do. And so that just leads me to the observation that it's hard. Again, if we were imagining 10 years ago that we'd be talking about a set of organizations and a set of interventions being at the point they are today, I don't think we'd ever ever imagined it. But to get to the next phase is going to require yet another whole change in behavior, how we invest in what we do, that's critical. And I can't think of anything more important to do. And I look forward to working with the folks in this room and others in trying to make that happen. Thank you. Ten minutes for questions. You're next.
Hello. I'm taking the mic again, but I take the privilege of doing it. Jeff, I think this is the most terrific overview that I have heard of where the field is going. It's worth listening to more and more. Let me take a small slice of a question that bothers me. More than half the, many more than half the philanthropies in the country are small. Let's say there was somebody sitting here with a $25 million endowment or a $250 million endowment, and we're thinking about the complexities that you're talking about, and they're in Corpus Christi, Texas, or Provo, Utah, and they're trying to think about what to do. Now we're talking about more than half the money in foundations, and they're generally stressed, stretched, not in great communication with their other fellows doing it or colleagues doing it. This, it seems to me, is the story for bigger foundations with bigger reach and deeper talent that can work their way through it and apply the messages and work on it. But for someone that I've been describing, who I meet a lot in the Association of Small Foundations and so on and so forth, I could see them sitting here and being just so frustrated, saying, what am I going to do? This is not relevant to me, and I want to do well. Have you thought anything about, or much about, how to bring in the wider set of people with the longer tail and where that long tail is going?
Right. Well, a couple things. It's a great question. The first thing is that I think that those foundations, those organizations can play a critical role in the scaling of what works. I mean, the partnerships, interestingly, in the Social Innovation Fund, for example, that Clark has regionally with Tipping Point in California, with the Duke Endowment, with the Kaiser Foundation in Oklahoma, there is a linkage that says kind of different players, local players, can connect to this broader set of ideas. But I'd also say, and maybe this is it's a good question for me to be able to just kind of now kind of tweak, kind of edit it a bit. The 100% could be in a city. What Strive did in Cincinnati is in complete concurrence with all of these principles, and it said, what would it take to move the needle for young people in Cincinnati? And I think you see people now regionally and locally actually asking that kind of question, which is a different question than how do we build a little bit of capacity to serve those kids incrementally and a few more. So I think the same principles hold of start with the right, move back at the local level. And you see this in Memphis now in education reform. You see it in Tulsa. You see it in cities across the country where people are coming together, using data, thinking of the field at that level. So I very much focused on national examples and 100% meaning all of the country, but I think the same principles reside locally and regionally.
Thank you. Sue Payne with the National Math and Science Initiative. And I'm going to come at it from a comparable way, but looking at it from the nonprofit perspective. One of the really challenging areas that we find is when we go into a community and we have a particular solution that has great results, we've been successful in scaling, but what that community needs is a system. They need something that addresses their entire system. So we constantly get schools that say, we love your math and science results. What do you have on after school or extended learning time? Right. What do you have on this? What about mentoring? Things that we don't offer. Funders say, we'd love to give you money, but we really need something that has some engagement for our employees. What can you offer us for that? So it's really our ability not to provide those things ourselves, but to be able to connect with other service providers, other nonprofits who can address some of those things. And coming out of 35 years in the corporate world, where I've had professional and industry associations where you could make those connections, there's not a natural place for us to go to make those connections in the nonprofit world. Love to hear your perspective.
Well, I think it's a great observation of just the fragmentation that exists that's part of the nonprofit sector. And I just want to say there's huge, the Tocquevillian view of nonprofits, local and so forth, in some sense is a different strand. It's a different speech, a different strand of things here. And I just want to note that about we're not trying to scale every single nonprofit on earth, but in places where there are services to be delivered, there are kind of product models, there are things to be scaled in this way. The inefficiency of, if you're a superintendent and you have 100 nonprofits banging on your door, each with one part of a solution, it's true, it doesn't work. But I think some of these collective strategies against common metrics and then some kind of support to bring people together. And I think if you were in business, I'm going to say that one of the interesting things in the last few months of looking at this issue is how much it circles back around to some things that we need to, I think, learn and just kind of better understand about business. So your basic question of how do you manage a distribution channel and in some sense a client relationship, a superintendent that's buying, like there's things to learn about how to do that. Now it takes money, it takes investment. There's a set of kind of innovations that I think fit into this, innovations in distribution. I mean, if we reduce the cost of what it takes a superintendent to work with 4 nonprofits that actually have a suite of products and services, it'd be very different. I mean, I was talking to somebody about a city in the Midwest just yesterday about the fact that all these nonprofits are being brought to the city. And it's like, it's a great thing. It's like, oh, it's so cool, all these big national nonprofits, proven programs all coming. But there's no overlay of coordination integration. And there could be, and it's not that you have to have some mega model, but it's just so suboptimal to thinking about what if we, in a Strive-like context, had a sense of what the metrics were we were trying to move and how these different pieces of the puzzle contributed to that. So I think it's a really good point.
Jeff, nicely done. Dennis Richardson from Hillside. I'm struck by your comments, particularly about fragmentation and investment in infrastructure, because they run counter to one another. So in human services, we have a highly fragmented industry, and the general public, and there seems to be increasing attention to this. The general public wants to see the services provided at the lowest possible cost, and typically that means as little administrative overhead as possible. Now, while there's some value in that, I think we fail to recognize that we need to invest in infrastructure. So your point earlier about technology, and when comparing the not-for-profits investment in technology compared to the for-profit community investment in technology. In the not-for-profit community at this point in time, particularly in human services, there is this emphasis on very little investment in infrastructure. And government seems to be emphasizing that not-for-profits should be spending less and less on infrastructure. So you have places like New York where the government is trying to require, or is requiring, that not-for-profits invest less money in infrastructure over the course of several years. Can you talk a little bit about that trend? And to me, it seems quite worrisome, and it would move us in a poor direction rather than in a positive one.
Yeah, I think it for sure would move us in a poor direction because it is kind of antithetical to trying to get results. This is why I highlight this what works movement. Right now we have individuals that are you're negotiating a contract saying this is crazy, like this, the way you're thinking about infrastructure and the way you're thinking about overhead makes no sense. All of us are doing this by ourselves, kind of contract by contract. I think this what works movement, and I'm not Pollyannish, I mean this is moving, I mean Linda Gibbs' like reality about what it's like to work in these big complex bureaucracies, I'm not naive about that, but we need more, in some sense, collective action about what it takes to deliver great results. I think the work that the announcement by GuideStar and Charity Navigator in the Better Business Bureau this week about overhead, about saying, that's not how we lead with determining what nonprofits are effective or not, is a hugely important piece of the puzzle, but it's going to take 1,000 times that force collective action in communities, I mean, a whole set of things to try to change and influence the paradigm on how nonprofits are invested in and how services are invested in. So I agree completely. I think it's going to be incredibly hard, but I'm quite certain, I'm just always struck when I talk to a nonprofit leader who says, I have this thing that works, and we're losing our funding from, like in a national funding stream, there's one, and literally they're by themselves on planes to Washington trying to convince various folks at HHS that they ought to get funding, and we'd all agree it's an evidence-based program and so forth. The notion that we aren't saying kind of with them, this is the problem, look at the opportunity if we actually do this differently, is a problem. I think we kind of watch each other go through this dynamic, but there's not quite enough collective voice and action to try to shift the paradigm. And that's in part what we need. One more, or Alex? Two more.
That was a fantastic talk. Thank you so much. Jeanette Ikovics from the Yale School of Public Health and Care. I want to ask a question about data dissemination. I'm a huge fan and somebody who does large randomized control trials. And you talked yet about implementation science. How do we get past the resistance, at least in the scientific circle, scientific publishing, for instance, where the RCT is not only a gold standard, but the gold standard. And there's so much resistance to as treated or dose response analyses, even if they're put forth as secondary analyses, they're discounted. So how do we really leverage the importance of implementation science and be able to use that to bring to scale without that resistance? Yeah,
you're like at the PhD level, and I'm like at kindergarten or something. So I'm a little careful of entering this. And I suggest, two things. One is I suggest when the panel comes up here in just 1 minute that you ask Gordon Berlin that question, because I think it's a great question. But the frame on it suggests a horse race. I mean, I am fixated on not having horse races. RTCs are very powerful tools for identifying what works. The organizations that I started out with, the vast majority of those have done RCTs, and we can have a lot of confidence that there's something happening there. So I think this is not, in my mind, that remains powerful. There are places where it's not very effective, and there is this whole implementation science piece. And one example is those of you that know Poverty Action Lab, and it's intriguing to me that globally, there are many more innovative platforms, my observation, not knowing very much, about small natural experiments, rapid learning, rapid prototyping, trying different things, that it's just striking to me that if you read the book, a really excellent book called Poor Economics, that lays out just a whole raft of these kinds of experiments globally, that we see less of that domestically, that sensibility. And I actually don't quite know why, but it seems like a real gap and opportunity to incorporate that kind of disciplined learning with a rapid about implementation, about program design that would really help move the needle here as well. I'm sorry. Oh, there.
Jean Orsman at Enterprise. My question is probably a bit tactical, and I apologize for that. We've scaled nationally by licensing our programs to partners across the country, so we've gone wholesale instead of retail. And one of the things that we've focused on is we allow our partners to brand their program locally. So our name doesn't show up all over the place except on the license, the check, and the evaluation and the copyright. But publicly, it's known as our partner's name. It's made me curious, in what ways does building brand both help and hinder scaling impact?
That's a good, a few thoughts on it, because it's a great example. And Gerald actually, I had this conversation with Sean Bowen, who works with Gerald at Europe, saying, is the community college thing a year-up licensed franchise thing, or is it a private label that they get all the tech, they get all of the capability and they do it themselves and it's their thing? And I think it probably varies. It varies by funding model, because you can imagine arenas where the brand identity across this network could take you into different funding markets, could take you into different, arenas, make you more appealing. I mean, does the YMCA value being connected to a powerful evidence-based brand, Or does it just want all those capabilities and it wants to be identified as the entity that is scaling this evidence-based brand? So I don't think there's a general answer, and you'd really have to look at what were the dynamics and success factors for that intervention, for that kind of system, and determine whether or not it was, the only way to do it, because the flip side of it, of course, is that there's a lot of not invented here, so that the power of people being able to access these ideas and incorporate them into their systems and own them and present them to their local communities as something that are really driven without any kind of confusion about is this a national program, could be, in other cases, a powerful thing. So I don't have a simple answer. I think it's kind of in some sense case by case, but you hit a lot of the key elements. So thank you very much.